guys, this is Dr. Ben. I wanted to jump on and just make a couple of clarification points on DTR providers and finding somebody close to you if you can't make it out to me. The office gets emails and phone calls every day. Where's the doctor nearest me? And how do I get to see Dr. Ben? And unfortunately, if you're traveling out of state to get to our office, that just about doubles the treatment of the cost of the treatment. And so I get people wanting to stay close within their local region. And so the whole reason why we created this database was we had doctors that are saying that they're DTR providers and they've never taken the test. They've never had one-on-one training. They haven't even been to the course. And it's like, well, how do you kind of protect the public? And that's kind of an important thing, because if you make adjustments in the teeth and you have good resolution, you can also make adjustments in the teeth and have less than ideal outcomes. So I want to give you the name of the database. Go to the website, digitalocclusionseminars.com. There's a drop-down tag that says DTR providers. You can click on that, and it'll give you, on the first page, it'll give you all the providers that are certified. And then if you're out of country, there are different tabs for different countries that currently have providers in. So when you go in to see a provider, it's always good to get a consult first. I would ask for that. The idea behind that is you get to get some data before you go home, and things aren't so abstract. So they'll probably put a teeth scan in your mouth, have you bite on the sensor. They may not hook you up to the EMGs, but they should have them. So make sure that your provider has those. Things that I would ask in a consult, like how many of these cases have you done? That's important. When did you get certified and start doing this? That's important. What do you do when you have an outcome that's less than ideal? I think that's important and reasonable. So the whole purpose of today's video is I wanted to eliminate any confusion, because there are some doctors that they provide DTR therapy in their office, but they've never been to a course. They don't own EMGs. They've never taken the test. They've never had one-on-one training. And those are absolutely 4 requirements before somebody gets on the DTR certified database. It's important to know that not everybody is a candidate for this, okay? Your bite has to be set up in a certain way, and the providers will be able to establish that when you go in. So through my observations of doing, probably 400 cases, completed 400 cases, the diagnoses that DTR helps the largest group of people with is TMD, or TMJ, as many laymen know it as, Meniere's disease, trigeminal neuralgia, headaches, migraines, as well as cluster headaches, and have several cases of cervical dystonia where the bite may not be the whole player, but is certainly a player in the magnitude and intensity of the symptoms. So I hope this brings some clarity to people that are, reaching out to the office, reaching out to other providers, so that they know, look, there's a simple way to find out if this doctor's on the up and up and they've been trained. Just go to the database and look and see if the provider's there, cross-reference that. If you have any questions, you can certainly call the office or email us. That's probably the best. But this is Dr. Ben. I hope that brings some clarity. And just remember, don't let your diagnosis be your prognosis.